I've been a neonatologist since 1990, and my career spans both academic and private practice. I have been a medical director in another level 3 facility before joining Alaska Neonatology in 2006. Prior to that, in academics, I had my own research lab in an academic institution and had fun doing bench research on surfactant research. And let's see, I have, as I said, I've been with Alaska Neonatology since 2006. We have currently 7 neonatologists will be in our practice when we are fully, when we have our full complement of physicians in the group.
How did you get into medicine? Were you inspired by a woman to enter the field?
Actually, not particularly. Okay. I had very strong role models in my life, in my grandmother and mother. My mom nursing, and interestingly enough, when I told her that I was going into medicine, she said, "Oh, thank God, because you would not have made a good nurse." And she said, "You can't follow orders very well."
Oh my gosh, that's funny.
But my grandmother was a very strong influence. She is an immigrant who spoke very little English, and despite that, managed to engage her community, and she had a private business selling Filipino goods all over Kauai when I was growing up. So I saw her interact with all levels of individuals and never afraid that she couldn't communicate. She figured out how to communicate despite the fact that she doesn't speak much English. And as far as getting into medicine, I remember being asked as a 7th grader what I wanted to be. And I said, I want to be a doctor. And I don't know where that came from, other than I thought that was a great field to go into. And I don't think I ever wavered from that choice, except for a very brief period of time in college when I thought I probably should open my options before I limit them to just being a physician. So I looked at engineering, I looked at pharmacy, I looked at research tracks, and then eventually came back to medicine as my choice.
What do you think it means to be a woman in healthcare today?
It means being an absolute juggler. It means balancing all aspects of life, being a good physician, being a parent, being a partner, and at the same time saving a piece of yourself for yourself. I think that's a very that's true in medicine, and I'm sure that's true not just for women but also for men in medicine. It's true for all of us in this career field.
What are some of the challenges of being a woman in your specialty and just the healthcare field in general?
I think maintaining the balance in our personal life and in our careers. Having chosen medicine, I think people go into medicine because they really are nurturing, caring people, and balancing that tendency to nurture and care for others with the need to be able to care for yourself is important. And that's a very big challenge. There's always going to be work that gets left undone, no matter how hard we work. And that was one of the things that I learned very early on as a neonatology fellow. One of my friends actually said, you have to be able to leave it. It will still be there. And we, as fellows in a very busy research lab, there was always something else we could do. And that was one of the most important lessons I learned early on.
On that note, what are some of the positives that come from being a woman in healthcare?
I think we bring to healthcare our empathy, our ability to juggle multiple things, our ability to care as individuals, and our nurturing personalities. I think women in general are very nurturing, And I think we bring that to the bedside, we bring that to our colleagues, and we bring that to all the families that we touch. I think that's one of the things that we solidly bring as a gender into the field. I also think that as women, we are often underestimated in what we are capable of doing. And I always take that as an advantage rather than a disadvantage. I think it works very much in our favor if people think we can't do as much and we show them, wow, how much more we can do and can accomplish. And that's the strength, not a weakness.
What advice do you have for women who may be entering medical school or the medical field for the first time now?
I would say, think about what is important to you. One of the most important aspects that I learned early on in medicine was in medical school. Our professors, both the didactic professors and clinical professors, had one common message to the medical students at University of Hawaii in my class. And they said, never forget that you are people. Value yourself, your family, your friends, and while you're doing the very best care you can. And they treated us as individuals and encouraged us to never forget that medicine is an amazing career, but in the end, it is a job worthy doing. But we shouldn't forget who we are and our families and friends in the process of getting into this career.
How do you think women physicians can best support fellow women physicians?
I'd say paying it forward, remembering the kindness and the things that people did for you along the way, to make sure that you are successful. I was very fortunate all along the way, from medical school all the way to my current career now, to my current position, where I was given opportunities, amazing opportunities to do well, to perform. I was never questioned as to my ability to care for patients. I was always encouraged, and as a parent, I had senior partners who really cared for me and my family and saw the value in my being able to be present as a parent for my children and as a spouse. I would say that is probably the most important gift we give to other young people in our practices. And I'd like to encourage everyone to remember paying forward those things that people gave you to be successful.
Anything else you'd like to add that we haven't touched on?
Absolutely. I would say medicine is an amazing career. And I like to remind people that it's a gift and a privilege to do what we are doing. I can't think of any other field or any other job where we enjoy what we do every day. I get to make a difference in lives every single day. And in neonatology, I can't think of another field where truly everything that we do makes a difference, whether the outcome is the death of a baby or a former 24-weeker leaving your unit intact, or with some challenges. What you do in that process for that family, for that baby, will make a difference in their future.